Hello, everyone, and welcome to the PHLCVB's third COVID update webinar. As most of you know, the PHLCVB has long been a leader in utilizing the amazing health professionals and resources of our region to help attract meetings and conventions to our destination. Our PHL Life Sciences Division was started over 30 years ago for that sole purpose and is today comprised of 50 advisory board members from the healthcare industry and its executive director, Bonnie Grant, who has led our efforts in this area for the past 12 years. When COVID-19 was progressing in the spring of last year, Bonnie established a 20-member subcommittee as a resource to help the PHLCVB relay information and share resources with our clients, members, and local partners. When we realized the enormity of information that was coming out and how hard much of it was to decipher, we felt the need to partner with someone in the local healthcare industry that could serve as an external voice to our customers. To support this effort, the PHLCVB partnered with Dr. David Nash, Dean Emeritus of the Jefferson College of Population Health, as the PHLCVB's Chief Health Advisor. Dr. Nash is an endowed chair professor of health policy at the Jefferson College of Population Health, where he served for more than a decade as the founding dean, culminating in a 30-year tenure. A board-certified internist who holds both an MD and an MBA, Dr. Nash is internationally recognized for his work in public accountability for outcomes, physician leadership development, and quality of care improvement. More recently, he has been lauded for his thought leadership surrounding the COVID-19 pandemic. Dr. Nash received a BA in economics from Vassar College. His medical degree is from the University of Rochester School of Medicine and Dentistry, and his MBA is in health administration from the Wharton School right here in Philadelphia at the University of Pennsylvania. And returning for another appearance is Dr. David Friedland, Vice President and Director of Scientific Affairs and Public Health for GSK Vaccines. He is a pediatrician and research scientist who is passionate about vaccines. He spends his days helping people understand the science of vaccines and complex ideas about how vaccines help to improve public health and the lives of patients. Following a rewarding academic career in teaching and patient care, he joined GSK in 2003 to focus his efforts on vaccination and public health. At GSK, Dr. Friedland is involved in the development of vaccines for use in children, adolescents, adults, the elderly, and pregnancy, including vaccines for the prevention of flu, meningitis, whooping cough, rotavirus, hepatitis, measles, RSV, and shingles. He is privileged to be GSK's medical and public health representative and spokesperson for U.S. vaccine topics at the CDC, other public health venues and congresses, in addition to media outlets. And prior to his work at GSK, Dr. Friedland was the division chief of pediatric emergency medicine at Temple University's School of Medicine. He studied medicine at the Mount Sinai School of Medicine in New York, and he's published more than 50 peer-reviewed articles during his career and many book chapters on healthcare and vaccination topics. And to help balance out this amazing intelligence we have with these two brilliant doctors, I'm Kevin Schieferdecker, the Senior Vice President of the PHLCVB's Convention Division, and I'm thrilled to be back moderating this event as they're always enlightening and always quite fun. But before we get started, I need to state that this webinar with Drs. Nash and Friedland is meant to serve as an informative discussion based on their knowledge and experience. As always, please refer to the guidance offered to you by your organization, the CDC, and state and local authorities. Please use today's discussion as a thought starter while planning your events over the next few years. Also, please note that the chat feature is not enabled, but you can add questions to the Q&A section, and we'll do our best to get them incorporated into the discussion. Dr. Nash, Dr. Friedland, it's so nice having you back with us.
Same here.
Thanks, Gavin. Great to be here. Hey, Len, good afternoon.
Same day.
Well, a heck of a lot has changed since our last webinar on December 17th, especially in the terms of vaccine distribution. Why don't we get started by having each of you share your thoughts on what's progressed over the past 3 months. And Dr. Nash, why don't you take the start on that?
Okay, well, great. So first of all, thanks again for having me and Len, and wonderful hard work on your part, Kevin, and Bonnie, the entire team from PHLCVB, and welcome to all of our potential customers too who are listening in. Really appreciate your carving out the time. So, wow, what a 3 months it's been. Incredible. So first of all, I know most folks are happy to see 2020 in the rear view mirror. So that's a definite advance since the last time we were all together. seems like 3 lifetimes ago because boy, time is either slowing down or speeding up. It's just so crazy. But I'm excited about where we are. And from my perspective, and I know that Len agrees, what an amazing scientific accomplishment, right? Whatever your politics. So by investing billions of dollars in a handful of companies and taking away the economic risk from them, and through the incredible hard work of a core group of scientists worldwide that started really on in January of 2020, here we are with 3 available, really effective vaccines. Who would have thought that we could get this done in absolutely record time? So folks in our field, people like Dr. Eric Topol and many others, and of course, Dr. Fauci and Dr. Walensky, what an incredible journey we've had, especially in the last 3 months. So Kevin, I'm very excited actually and optimistic about the future as to where we are. Since I'm also Medicare eligible now, and because our health system at Jefferson has vaccinated every single employee who wanted to be, I'm happy to report that my physician wife and I have both gotten both of our vaccines. I'm thrilled about that, and I'm sure we'll come back to that. But my major impression, to answer your question, of the last 3 months is an incredible scientific feat. Now comes the hard part, human behavior, but more on that in a moment.
Yeah, thanks, David. And just to add to that, on top of the incredible scientific feat, we're now seeing evidence of real world effectiveness in many countries around the world that have had impressive rollouts of vaccines, including in Israel and other countries, but even here in the United States, we're already starting to see effectiveness data showing that these vaccines, regardless of which one people are receiving, they're all effective in preventing serious outcomes of disease, decreasing the stress on the healthcare system, and allowing people to have optimism that better times are coming and that we'll be able to get back to this new normal. And I think that's tremendously exciting. Science really has led the way, along with now also a bolstered public health system and people really thinking about the next steps. How can we take these vaccines and change the way that we're behaving safely so that we can get back to business? It's an incredibly exciting time. And one other thing to mention, besides just vaccines, we're also seeing the introduction now of effective therapeutics. So for people who do get sick, who haven't had the chance to be vaccinated, let's say, or have some underlying comorbidity that put them at higher risk, there are ever increasing effective medications to help people as well. And that's great news as well, because no vaccine is ever 100% effective. There will be people who will get infected. The good news is that we have better ways to manage this and make this into, we don't want anybody to get sick, but we can manage this better than before. And that's all part of getting back to normal.
It's still, correct me if I'm wrong, is it still too early to tell is the efficacy and how long this vaccine will last and if we'll need a booster shot?
I'll take that one.
Go ahead, Len.
Let's start. We don't know how long any of the vaccines will last. That's being very closely looked at by the Centers for Disease Control here in the United States. All of our hospital systems that have research arms are looking at this. It's being looked around the world. But what we can say is that all 3 vaccines that are now authorized in the United States, they're all highly effective. And it doesn't matter which one anybody receives. What's important is to get vaccinated. We're seeing 2 to 3 million people vaccinated every day in the United States. That is an incredible advance from where we were at the end of December when the vaccine first was authorized, the very first one. So it's incredible, and we are seeing impact, which is exactly what we need to see.
Indeed.
So on that point, we've seen Pfizer, Moderna, and J&J come out with vaccines. AstraZeneca seems to have hit a roadblock. So Dr. Friedland, talk to us about that and whether you think additional companies will come out with vaccines.
Absolutely. So let me start with AstraZeneca, and then I want to also mention the vaccine under development by the company called Novavax. So AstraZeneca has a vaccine that uses the same type of technology as the Janssen or J&J vaccine. They have now reported results. There's been in the news this week. What's important next is that they submit their file, their application, their data to the Food and Drug Administration. They say they're going to do that within the coming days. And that will start the ability for the Food and Drug Administration to review every piece of data, every single page that's submitted. The FDA will go through. They'll have an advisory committee, as they had with the other 3 vaccines, presumably within the next few weeks after the file is submitted. And then also the Centers for Disease Control will review the data and the evidence that will lead them to make their recommendations. So it appears that they have, this AstraZeneca would be the 4th highly effective vaccine that would play a major role for protection for people all around the world. In addition, Kevin, there's another company that is about to finish up their pivotal phase 3 studies, and that's a company called Novavax. We expect to see their results from their United States study also within the next few weeks, and then hopefully that will be the 5th vaccine that will be submitted to the FDA for review and then to the CDC for recommendation. So it's incredible to think that we now have 3 and perhaps soon 5 highly effective vaccines that are safe and offer benefit to people all around the world. That is just incredibly exciting.
And there are other vaccines in other countries, not in the US, that, as far as we could tell, are also working. So
Absolutely.
that's good news. And especially our colleagues in India that has an amazing pharmaceutical infrastructure. They're very likely to have their very own vaccine with some of our technology. Really important. You know, Kevin, we're going to need roughly 800 billion, right, with a B, doses to get this all done. So it's a big deal. And we got to make sure that we have multiple avenues to get there. But we're mainly talking about the United States, and Len did a great job summarizing, what's available.
Yeah, and one last thing to say on this, the Biden administration has put out as a target that everybody in the United States who wishes to be vaccinated should be able to be vaccinated by May 1st. I read yesterday that 40 states believe that they can exceed the May 1st target and will be able to offer vaccine to everybody over the age of 16 right now in their states prior to May 1st. So that's just truly remarkable. And it's highly encouraging for our future. So it's incredible.
And it seems like the news keeps changing. As I know we've talked about in our past webinars, we need to be flexible. We need to be understanding that the more we learn, the better off we will be. I remember probably 4 or 5 months ago, there was discussion that many of us in the final stages might not get vaccinated till Q3 of this year. And we're already saying now by the end of April or May. That's pretty amazing how quickly things are progressing.
And remember, as Len was mentioning, so President Biden, when he said 100 million doses in the first 100 days, many skeptics thought not possible. And the administration beat that record just about 60 days in. So I think that's also testimony to when we put our mind to it and people collaborate, we can get it done. And I think that's another really positive reflection on the last 3 months since we were all together. By the way, earlier today, Governor DeSantis in Florida, and whatever you think of his politics, I got a text message that anybody over 16 can now get a vaccine in Florida. So to Len's point a moment ago, this is happening quickly. And since we all saw the news of what was happening in Miami Beach in the past week, the sooner they get those vaccines over there, the better.
Right. And Kevin, if I could add to this, given that vaccine availability is increasing literally by the day, which is truly remarkable, I think it's all of us to lead by example, to speak to the members of our organization and stress how important it is that everybody be vaccinated. We're still seeing large segments of our population be on the fence about vaccination, questioning, wondering, not wanting to be first. So if we can all, rally our members and show how important it is, because we want to be certain that when we get back to gathering in the not too distant future, that the people around us are also protected. And then that's going to be a big part of what we need to do. So we can tell our members, I was vaccinated. The leader of our organizations, put it up on your social media within your organizations and say, our leadership team was all vaccinated, maybe some pictures of it happening, et cetera, to show how important it is for you and down to the members.
Well, I certainly agree with Len on that point. Even if you're not in a health system like Jefferson, whatever organization, I think the leaders have an important obligation to get vaccinated and to lead by example and to educate. So I think that's a really, really important point for all of our listeners. I hope in their organizations that there's an education component and leadership demonstration of how important it is to actually get the vaccine.
So with so much focus on the vaccinations taking place and all the good news and the appropriate hype to it, testing for COVID seems to have taken kind of a back seat in the media and discussions, but it's still going to be very important. Is that correct?
Well, I think testing has been undervalued since the beginning. You know, there's no question that we probably dropped the ball as a country, that we made an unbelievable investment in Operation Warp Speed and a very, very modest investment in point of care, meaning available at home testing. We probably could have really done a much better job on the testing front even months ago. But to get to where we are today, Kevin, I think there's definitely an important role for testing, especially in the corporate world, excuse me, for companies who want to safely reopen, for individuals who have lack vaccine confidence and didn't get the vaccine. I mean, they're going to need to be probably tested for social gatherings where there's clearly folks who, for whatever reason, didn't get vaccinated. And then where are we with folks below vaccine age and grandparents wanting to see their grandchildren? So I think there's still going to be a very important role for rapid, more effective, sensitive, and specific testing.
Yeah, testing has to remain a priority and increase in prioritization. We're seeing funding through the legislation recently for money for testing, but also organizations will need to find ways to embrace this and utilize it because it will help us get back to normal and all feel comfortable with what we're doing.
Let me take a step back to vaccination. We had a good question from one of our attendees who's one of our great cab members. She mentions the eligibility for the vaccine and the ability to get one are very different. So address that.
Well, why don't I take a first crack at this from a population health perspective? Look, as we talked about last December, and even since I've had the pleasure of being a part of the PHLCVB team, what have we learned? Well, you know, the pandemic shined a bright light on our failing system and our lack of responsiveness to many communities and the disparity in care that we've always delivered. So this bright light is something I think we wish didn't happen, but you can't deny it. So here in Philadelphia, a good example, Kevin, as you know, and Len knows, we've had a very deliberate approach to getting to communities of color, other underrepresented minorities, bringing the vaccine to them, to the homebound, to folks who are incarcerated, to people who lack transportation. When we say, well, we'll have a mass vaccination site and all you have to do is drive your car there. Well, that sounds great if you have a vehicle, but if you don't have a car, what are we going to do? So I think there's been, I would say, much more sensitivity to this issue, especially in the last 60 to 90 days than almost ever before. And in our city, we're very fortunate to have folks like the Black Doctors Coalition and many other community groups who have really taken the leadership role some of them in concert with the delivery system like Jefferson, others on their own, to get out there and get the vaccine to the folks who need it. So we're making progress, certainly not as fast as anybody would like to see, but I think the first step is recognition of the problem, and the second step is making progress.
Dr. Nash, we're starting to see get a clearer picture of returning to life as we once knew it. There's much discussion about offices opening up this summer, and we're seeing a big increase in interest in hosting face-to-face events in Q3. What do you envision a meeting will look like maybe in the fall or winter, and what are some things our meeting professionals and partners will need to consider for meetings over the next couple of years?
Wow, that's a great question. And I'm sure many of our listeners, this is their top question. So I have a visual that might be helpful. When I think of trying to answer this question, and boy, Kevin, whoever gets this question right should go to Las Vegas with their whole family just as soon as possible. But here's the visual that I have. Think of sort of 3 dials, if you would. One dial is increasing availability, supply, access to the vaccine. So more people getting vaccinated. The second dial is overcoming the vaccine lack of confidence, hesitancy, getting more people educated about the effectiveness of the vaccine. That's sort of the second dial. And then the third dial is one that we can't control totally, which is the emergence of the new variants, and some of which appear to be more infective and maybe even more lethal. We're evaluating all of that and how we calibrate these dials, and maybe a fourth dial, which is the public health response of mask wearing, social distancing, hand washing, stuff we're all tired of hearing about. So I see sort of this dashboard with these dials, and we're moving them, and they're all in movement all the time. So now to answer your question, I'll give you my view. I'm an optimist. I think the vaccine supply is an amazing accomplishment. And I'm hopeful that we'll be able to have face-to-face meetings, scientific meetings, all kinds of meetings, maybe even a trade show in our great city in the fourth quarter of this year. I've always contended that. I'm more confident than I was in December because of the vaccine effectiveness and the volume of vaccination. If we could really get to most people vaccinated by Memorial Day who want it, then I think Philadelphia will be ready to host in-person meetings in the fourth quarter. However, of course, some of this is out of our hands, and we have to abide by the rules of our Commissioner of Health and the mayor. So maybe that's another dial on that dashboard. But personally, I'm optimistic about our ability to have an in-person meeting, especially in our beautiful convention center with millions of dollars of new investment in improved ventilation in a city with 5 medical centers. I think we'll be ready when we get the word that we can move ahead.
Yeah.
Let me ask, when are the two of you planning on attending a meeting, or do you have anything on your calendars coming up here in the next many months?
I'll start with that one. There are some meetings I'm looking to attend in the September, October, November timeframe. I was actually at the Philadelphia Convention Center about 4 weeks ago as a physician volunteer doing COVID vaccinations. And as I was coming into the building, I was looking around and said, I can't wait to be back here for a meeting. It felt good to be there and to see that it's a big open space with lots of opportunities to host meetings safely, effectively, with space and distancing, ventilation, and it felt good to be there. And I'm planning to be at meetings in the September, October, November timeframe. I expect, though, that they're not going to be exactly as the meetings were in the past. There may be some sessions where I may opt to stand in the back of the room where there's a bit more space, and I'm hoping that there's, the seats are a bit further apart. I may look to when I get together and say, you want to meet up? I say, yeah, let's meet up outside in the atrium. of the building, et cetera. So I think we're all going to adjust, but I'm looking forward to networking and being around people and having that experience.
And we're seeing
Likewise.
also on,
Yeah,
I'm sorry,
likewise.
LinkedIn and different places, events are happening. It's nice to see. And to what you're just mentioned, trade show floors that are much more spread out, paths of clarification of pathways and attention to detail on some of these foyer areas. We've actually got a group moving in right now, yesterday and today, into our convention center. It's a different event. It's not a business meeting, but it's the volleyball tournament of young high school girls age 12 to 18. And we had to present a very detailed plan. And we had a great partner client that's working with us back and forth with the city to help them understand, to Dr. Nash, your points, all the great enhancements. It's the convention center with the air handling systems and the UV protection, the wide spaces. They allowed this event. And we're hoping to see, as things progress even further and further, and other things are happening around the country and the world for that matter, that it can be done effectively if we do it. We're hoping to see even more meetings take place, because those are the kind of questions a lot of our customers are having. But a lot of it is that point. You've got to have a plan. Just like there was a better plan in place now for vaccination distribution and it's taking off, our clients and we and our partners at the convention center are going to have a plan for every meeting being somewhat different. So,
well, I think Len had a great point, Kevin. I'm looking forward to going to a meeting in late August, a National Healthcare Information Technology meeting, one of the biggest ones, hopefully, and late August in Orlando. So it's going to be hot. So I hope that their ventilation system is as good as the one that we now have. But with regard to what the meeting might look like, I think Len had a great point. Sure, it's going to be more spread out. Sure, we'll probably still be wearing a mask while we're at the meeting. We might be testing people who don't have a vaccine passport, as one example. We might have folks in the room more spread out. The buffet is going to look very different than it used to. Maybe everything will be prepackaged, and there'll be encouragement to go outside despite the heat to have your lunch or dinner. And what the hotels will look like, and the transportation back and forth from the convention hotels to the convention center. So I think flexibility is the watchword that we're going to need. But I'm looking forward to returning to seeing colleagues, getting brought back up to date on all kinds of topics, and just the important hubbub of something we've all missed for so long, of being back in the conversation together instead of just virtually.
Good. What I'd like to do now is take the pulse of the meeting professionals and clients on the call with a quick 3-question survey. So Cree, if you can please throw up the survey on the screen. And if you're a hotel partner or one of our staff members, please don't answer the survey. So take 30 to 45 seconds, real quick questions, and we'll see what the results are. And I mentioned on our pre-call, Doctors Nash and Friedland, we had a customer advisory board meeting yesterday with actually a number of our members are on this call as well today. But we had asked them a similar question going into the meeting about when they plan to be back to pre-pandemic attendance levels at their meeting. And I was thrilled to see that 65%, 13 of the 20 respondents said they will be at pre-pandemic levels by Q2 of next year, a year from now, which is faster than I think many of us had been hearing or seeing. But I think it goes to the point of how much progress we've made in the past 3 months as a country and as attacking this vaccine. How do the results look, Cree? Coming through? Okay.
Yes, we're coming through.
Thank you. And Dr. Nash, you have got a personal event coming up. Your daughter's getting married in October. So away from a medical meeting or COVID thing, talk to us about what you're seeing in terms of challenges and differences in planning for something like that.
Oh boy, you put me on the spot, Kevin, but I know it's good natured. So, here we go. And I sure hope I don't get in any domestic trouble in trying to answer this one. So yes, we have a wonderful, blessed opportunity. October 9th is the big day for my daughter and her fiance. So here's what we're doing. And full disclosure, this daughter is an attending hospitalist physician who's been on the front lines of the struggle right at the bedside since day one. So, we're awfully proud of her. So look, we've made a decision as a family, along with our new family, that you have to have been vaccinated if you come to this party. No one will be invited or allowed to attend if they haven't gotten a vaccine. No children will be part of the ceremony or the party. That's a tough one. And we're making the same demands of the caterer, the band, the photographer, and all the other things that go into making for a wonderful event. And look, I'm the father of the bride, so I'm not involved in too much of the details. But being in this role and having a daughter who's a doctor and my wife's a physician, so we've made the decision, and I'd be curious what people think, that you can't come to this party if you've not been vaccinated. We're very sorry, but that's what we're going to do. And as Len pointed out, even with that, I think we're going to be cautious. We're going to have hopefully a pretty big space available. We're all going to spread out, but we're also going to have dancing and a good time. So it's a balancing act. There's no question about it, but that's how we're going to approach it.
Good. Well, good luck. And it sounds like a lot of the challenges you're having or points you're addressing are very similar to what our customers will be addressing in terms of, will they require their decorating company and their partners to be vaccinated? Those are things they're going to have to answer. Yes.
And it's been a journey. And I think, again, the theme this afternoon on flexibility, I won't name names of the vendors, but they've been mostly amazingly helpful and collaborative, because we all have the same goals and objectives. We want to have this event. And again, it's all going to depend on our Commissioner of Health and our mayor. I hope we'll be open for indoor business for a crowd of almost 200, by October 9th, or even way before that would be great. So I think the flexibility is still the issue. And look, this is a private family event, so we have that ability to make a request, a real strong request about vaccination. Other organizations, in the private sector, you may have to be more flexible. There'll be issues about folks, for whatever reason, that didn't want to get vaccinated. That goes back to where we were before about the testing.
Yeah. That's interesting, because I know, David, you have this feeling as well. I think the private sector is really going to lead here. We can't wait for the U.S. government to establish national recommendations. I think they're important, and I hope that they do come. I know eventually they will. But as the evidence is gathered, we still need to move forward. We can't have paralysis, sort of, making paralysis because we don't have the information. And so private organizations are going to make requirements, and David's wedding is a private event. So you're your own private organization. But for meetings, etc., we just have to work together and expect that I think the attendees will expect this as well. They're going to be looking for what are the rules? What's the way of working for this meeting? And perhaps they won't all be the same. But as long as people know what to expect, then we can move forward.
It seems logical to think that those organizations or groups that have more information outlined beforehand
Yes.
will have higher attendance. They'll feel safer. They'll know that the organization they're working with has a plan, and that's going to matter. I know for me personally, it's going to matter. Cree, can we show the results of the survey, please? So the first question, the progression of the vaccine, has it pushed up your organization's plans? 42% of them said yes, 11% said no, and 7% said too early to tell.
Wow.
Number two, are they considering proof of vaccination before attending an event? No, that's interesting. A large number says no right now. That's a higher number than I was expecting. Number three, when is the earliest your organization is considering conducting face-to-face meetings of 50 people or more? So that's pretty promising. 23%, I'm sorry, 76% by Q4 of this year, and a third of them are by Q3. So that's great to hear.
Wow.
Right there. Good information. Thank you all. So moving on, we talked about the vaccinations and the vaccine passport. That's fantastic. The long view on COVID-19. Dr. Nash, what are your thoughts on reaching herd immunity status and the importance of that?
Yeah, I want to address first the results of the survey, if I might, for a moment, especially with all of our amazing colleagues who are tuned in. So look, you read the Wall Street Journal just like I do. There's been an amazing amount of high quality, in-depth reporting. I learned something just this past week, Kevin, that every vaccinated person is worth about $5,000 towards getting us back to a robust new post-COVID economy. $5,000 worth of goods and services, even a little bit more than that. So, I think we have not only an important scientific reason to get vaccinated, and I think Len's done a great job educating us. I think we have a economic reason. You want to open up. The most important way to get the economy going again and get people employed, especially in the convention business and the hotel business, is for people to get vaccinated. There is a direct connection here. So I was surprised that there doesn't seem to me, based on this little survey, to be a mandate for vaccination. So let me try to answer your other question now. Look, I'm excited about and optimistic about the future. We have, we're at the corner point, the tipping point right now, if you would. If we could persevere with the public health measures, I know it's hard. I know we're all tired of it. If we could persevere with the public health measures and let this amazing science of the vaccines do its thing, and we're flexible, I think fourth quarter of this year is going to be very, very exciting in a very positive way. So, and I hope that folks will want to come to Philadelphia because we're going to be ready. And that's what's so exciting about being a part of this broader team of great people.
Yeah, history repeats itself in so many ways. If we look back to the flu pandemic of 1918, there was similar fatigue around that, and the way the messages were coming down, and people were, not only they were extremely anxious to get back to business, and then there were some additional little waves that came through, and so this is no surprise that we're having fatigue. But it brings us back to the question of vaccination. So just speaking as a scientist now for just a moment, the power of vaccination is to stop the people from spreading this infection. This is a respiratory infection. And from an epidemiologic standpoint, if we can get the reproductive number below 1, then a person who is infected who could spread would be spreading to less than 1 person. And that's when the numbers really drop. And we see in countries where they have high vaccination rates, this reproductive number is below 1. I've seen reports of 0.7. So that means that 1 person affects less than 1 person. And that's why vaccination is going to be so critical for our members who are going to be attending events, because we don't want to be spreading. And so if you come to Philadelphia in the late summer, early fall, and our reproductive number is below 1, then it's unlikely that we'll have any spread. And so that's why we need to have people vaccinated. We need to get our numbers below this threshold of 1 so that we can, because there'll always be people who will have the ability to spread. No vaccine is 100% effective. This virus is going to stick around. You were asking about what's the future. It's likely to become endemic, like we have flu every year or any other sort of cold virus. But if we can control it so it doesn't have these epidemics and these tremendous out of control events, then we can manage it. And that's what we need to do. We need to manage this. And the tool to do that is through population vaccination. Kevin, you were asking what's the number for herd immunity? I'm going to pull a Dr. Fauci. I'm not going to give an exact number because we just don't know. What we know is we need to have a lot of our population vaccinated, something more than 3/4 or something on that order. That's what's going to get us there, because also we have a lot of people moving back and forth. So you could have a population in Philadelphia at herd immunity, but if people are coming in from the outside, they could bring. So we need to, as a society, have this high rate of vaccination, and that's what's going to get us, and that's what is getting us back to the new normal.
I think we should ask Dr. Fauci what he thinks of the question, Gavin, and he's here to help us. Hi, Len. Good to see everybody. So Len is right. There is no exact number for herd immunity, despite how much press it gets, right? But the best guess is somewhere between 2/3 and 3/4 of all the people. I would add one other thing about this herd immunity. Given that so many people probably have had COVID, and because we have not had great widespread testing, it's likely that millions of Americans asymptomatic were infected, which would help us to get closer to the magic number for herd immunity. In other words, there's some positive news, even as it relates to achieving herd immunity, based on the fact that lots of people have probably had COVID, don't even know it. But that also means that we've got to go back to the testing question you asked 20 minutes ago, and to the results of that survey. If you're going to come to our town and have a successful meeting and the R0 is below 1, let's hope so, we don't want you to have a super spreader event for your organization. That wouldn't be good for you as our customer or for our town. So we're going to need to be flexible and have social distance, mask, hand washing, great ventilation. Oh, and probably lots of testing on a regular basis. How do we all think that the NBA made it all work, and the NFL and Major League Baseball and March Madness? These folks have been tested and tested and retested. That's how they've done it. So the private sector has a responsibility here. And I love what Len said earlier. Set the expectation. You're going to come to Philly. You're going to have a successful meeting. And here's what we're going to need to do together to achieve this common goal of a successful meeting.
It's a good point, because yesterday on our customer advisory board, in a couple of our customers suggested we stand on top of the mountain and yell about how great Philadelphia has been in terms of being safe, and we don't want that should give you and you as an organization a better assurance that the population your attendees will be melding with in our restaurants and in our nightlife are better protected than some other cities, because we have been very cautious and very, very safe in that aspect. So it was a great learning from us on that point. Question, Dr. Nash, came up in the chat. How are you, back to your wedding? How are you going to verify that they're tested or they've got the vaccinated?
Yeah, great question. So that's evolving too. I think there's a couple of ways. So we're going to have probably an outside organization help us to keep track and have folks submit proof that they've been vaccinated. There are several apps already out there ready to go. One is called Common Health. Perhaps we'll use that one. One is called Common Pass. So we'll be studying this during the summer. and we'll be looking for some kind of easy, unobtrusive way to verify that folks have gotten vaccinated. Look, I didn't invent this. I believe really smart people like Art Kaplan at NYU and elsewhere, the experience in Israel with the armbands. My view is we will have vaccine passports. I just don't see any way around it. That's my personal view. I think it's a good idea. I'd like to see that happen. And many smarter people than me have been very public advocates of a vaccine passport, and the early experience, most especially in the United Arab Emirates and in Israel, supports the use of a vaccine passport.
And I could see airlines or, some of those companies might be a hard decision, but it would make sense. You have to show ID to get on a plane.
Indeed.
Why not show that you've got a vaccination?
And remember, if you're a parent, you know that you've dealt with vaccine passports, getting kids into school way before the pandemic. You didn't have your MMR and your various other shots. No shots, no kindergarten. So, if you've traveled overseas to many countries, you don't have your diphtheria or whatever it is, your hepatitis, you don't get in. So, I know there's strong views here. That's why I'm saying my personal view is I'm all in favor of a vaccine passport.
I am as well. And there are other groups. I wrote down some notes on this. IBM is developing a digital health tool. The International Air Transport Association is developing a smartphone app for passengers with information not only about vaccination recommendations, but also about testing. Airports now have fast ways to test. I think Jefferson actually has a clinic at the Philadelphia airport for rapid testing. My concern about this is that we have to get started, but we also have to make sure that we don't leave people behind as well. So, the equity issues, access is critically important. And I know it will happen, but I think we're going to see the private industry be ahead of the curve here because we have to get started. And I think these are very reasonable expectations. And if people don't want to follow them, then they can choose not to come to the meeting. I think that's their choice.
Right. We're not forcing anybody. Exactly. Right. I think Len's point is well taken. We're not forcing anybody, except maybe in a private event. But I just think it's inevitable that we're going to evolve toward that direction of having some kind of proof of your status. And we've had good examples of that already in our society without a government mandate.
Great points. Well, I think at our next call, and if we do this again in 3 months, which I hope we can get you all on board to do that, I think we'll be at an even further point where we'll have a lot more of these tools in place that are being utilized, and probably by a number of the customers that are on our call today, if they plan their meetings in the back half of this year or in early 2023, they will have already progressed to that point, having talked to vendors and partners like with these types of tools. So we are at the 12:50 mark. I see we've covered the questions I had. I don't see any other questions from Alicia coming through to me.
I have a question, Kevin. Yes, I have a question if the listeners don't. So here's something that's on my mind. I'm going to ask Len, and because I know people are thinking about it. So who's traveling right now on airplanes? Turns out it's mostly our peer group going to see their children and grandchildren. Even in my social circle, we've seen more people get on planes in the last 2 weeks than in the previous 11 months. So if you've been vaccinated and you're going to visit young people and children who have not been vaccinated, what do we recommend when you get there? Do you have to quarantine? Do you need a test to make sure you're not a carrier? What do you think we ought to be recommending? Because so many, let's say, Medicare eligible folks are out there flying for the first time in a year. When they get to where they're going to see the kids and the grandkids, what are we recommending for these people?
Yeah, I think the key here is who's at risk.
Right.
And so the people who are traveling, are almost certainly fully vaccinated, and they themselves The risk is not for them. It's rather to who they're going to. And so if you're visiting somebody who has a child, or maybe it's one of your children, whatever it is, but if they have underlying medical conditions, and if they were to get sick, or rather, if they were to get infected, because the traveler is an asymptomatic transmitter, what's the risk to the people you're around? And if they're previously healthy people, where if they were to get infected, their likelihood of getting sick is very, very low, then that's a very different equation than if you're going to visit somebody who is on chemotherapy because they are being treated for cancer. So that is really the scenario. So you have to think about who you're visiting. It's not the traveler, it's rather the people you're around. And that's the same thing for home gatherings. Perfectly fine and safe to have home gatherings. You just have to think about, is anybody potentially at risk who's coming to the gathering? The other good news is that when we do get to meet again in 3 months, and I actually hope I'm going to get myself one of those bobbleheads, maybe the David Nash bobblehead, but is that when we do get together in a couple of months, I lost my train of thought about this. Oh, yes. We're likely to start to have our adolescents being vaccinated. And we know that our adolescents are high transmitters, unlikely to be sick themselves, but likely to be transmitting. I think it's very reasonable to expect that all 3 vaccines that are now authorized will be authorized or licensed, if that's the pathway that they're going to go through, for use in people 12 years of age and older by the summer. In other words, in time for getting back to school. And so we're going to have our adolescents vaccinated. So that's another group of people who will also be less likely to spread in our settings. And then as we move into 2022, we'll be going down to children, younger children. So that's a good development as well that we can speak about in 3 months, because I think we're going to start to see some of these data. I would start to think probably next month, we're going to start to see some of the results of the adolescent clinical trials. And that's great news.
Hey, Kevin, when we get back together, to follow Len's analogy, I'm really hoping that every single organization represented here has leaders who have gotten vaccinated and are out there educating everybody as to how important it really is. I really hope that they could say to us that every single organization and its leadership are committed to getting vaccinated. That would be a great outcome of our collective work.
And if I can add one public health message on top of that, and I know that David, as a public health physician, will be supportive of this. As leaders, we also need to make sure that our members of our organizations are vaccinated against the other vaccine preventable diseases that adults are recommended to be vaccinated against. So that's pneumococcal pneumonia vaccines for people over 65, shingles vaccine for people over 50, the influenza vaccines when we head into the late summer, early fall next year, and then catch up around hepatitis vaccinations as well. Critically important that we're all up to date. Wellness visits completely plummeted during the pandemic. People weren't going to their doctor, they weren't going to the pharmacist, and they missed vaccinations for adults and adolescents as well, and children. Close to 11 million pediatric vaccination doses were missed and never happened during the pandemic, and similar dramatic numbers in adults. So as leaders of our organizations, let's make sure that our members are protected against all vaccine preventable diseases, which now include COVID.
Great point. Interesting numbers there. A little scary. Thank you for your time. I did see one other question, kind of on a side note, about food and beverage being allowed for the volleyball tournament. We are not going to be having food and beverage in the building. That Dr. Farley did suggest we not do that. That does add a level of time without masks on. There will be no concession, so they are allowed. The players are allowed to eat energy bars, but that's about it. On a related note, we are working with our city leaders. Actually, Greg Karen, our CEO, and some leaders from our hotel community, some general managers, met with Dr. Farley yesterday and Dr. Epstein, 2 of our city health leaders, educating them on the importance of having the need to have meals at business meetings. Our business meetings have been allowed, but it's hard to have a meeting where you cannot eat. So they just had a great meeting with them yesterday. We hope to hear back from that very soon. But that's part of the challenge we're having. And I know in talking to my counterparts from DC and Chicago and Indianapolis earlier this week, they're all in the same boat. We are all educating our individual municipal leaders or state leaders on this. And that's one of the best thing, or one of the toughest things about having the society we have, the federal society we have, where every state and every jurisdiction has their own rules. We have to do this education. And that's why you see some places opening up a little more early, a little more cavalier than others, and some other areas not being that. So that is what we're doing. We hope to see, we have seen some dramatic growth in allowances. We're also working to get our city, we've been educating them on the time that's required to have a meeting, that we can't just tell a group tomorrow they can meet the next day, because all of our big associations and citywide conventions need a lot of time. So we hope to hear very soon some outline timelines about what will be happening as vaccinations continue to rise.
Wow.
So more to come on that. David, Len, thank you so much for your time. And I also want to thank everyone for attending, for participating in the poll, and for sharing some good questions. We look forward to having another event like this in another 3 months again. And if we're continuing to progress as we have, we'll be at an even better place. So we are on the hunt now for a Dr. David Nash bobblehead. And Dave, you have something else to add?
Yes, I wanted to say, maybe we should tell everybody the secret, Kevin, that we're also working on a super low calorie cheesesteak, which will be ready just in time for the fourth quarter. Don't tell anybody, but we'll be ready. Super low calorie, great tasting, healthy cheesesteak. You heard it here first.
David, thank you very much. Len, thank you. We appreciate it. And to all of you, thanks so much for your time and participation. Have a great day and stay safe, everybody.